The infected blood scandal is not merely a public health failure. It is, as Sir Brian Longstaff put it, the worst treatment disaster in the history of the NHS. More than 30,000 people were infected with HIV and hepatitis C between 1970 and the 1990s. Many were children, haemophiliacs, trusting the state to care, not to contaminate. Over 3,000 have died. Thousands more live in pain, fear and economic hardship, and for decades they were met with silence, denial and delay. Between the mid-70s and 1991, contaminated blood products were imported and used in NHS treatments, often from high-risk donors in the United States, including prisoners and drug users, and the state's medical apparatus turned a blind eye. Lives were destroyed, families were devastated. What followed was not only infection, but a betrayal so systematic it amounts to institutional gaslighting. And this wasn't a one-off error, it was sustained neglect bolstered by bureaucracy, evasion, and what many victims call a culture of cover-up. I put my cards on the table here. I'm on the haemophilia scale, so I was incredibly lucky not to have been caught up in this. But I feel deep sympathy, empathy for those people who are caught up in this. And the Infected Blood Inquiry, chaired by Sir Brian Longstaff, published its final report in May 2024. Its conclusions were damning. Victims were not only suffering from disease, but from decades of injustice. And the government has delayed compensation, imposed unnecessary barriers, created systems so arcane they perpetuated harm. And Sir Brian's warning was blunt. Victims are dying in limbo. And he demanded faster and fairer compensation. Crucially, he recommended that claimants should not die with their victims. Justice must outlive the afflicted. In response to the inquiry, the government has announced major changes. While long overdue, some steps are commendable. Claims will now be inheritable, meaning compensation doesn't evaporate if the victim dies before it's paid. People infected with HIV before 1982, previously excluded, will now be eligible. The requirement to provide exact diagnosis dates for hepatitis is being scrapped. Interim payments to deceased victims' estates have begun, with £400 million already distributed to 587 people, and £11.8 million has been allocated in total. These changes follow 16 specific recommendations, and the government claims it will implement all of them, some immediately, others after consultation. It has for once not rejected a single one. The Infected Blood Compensation Authority, the IBCA, has also pledged reform. Its early days were farcical: 2 men, a laptop and a phone. Now, under pressure and scrutiny, it promises to build a proper registration system, improve transparency, and pay the first full claims before the end of 2025. David Foley, the IBCA's chief executive, had made it clear the victims must be heard. Process must not stifle justice, and symbolism matters. At last, the government is creating a national memorial. Clive Smith, president of the Haemophilia Society, will chair the Infected Blood Memorial Committee, and memorials will be established across the UK. The aim to honour the dead, acknowledge the truth, and remind future generations what happens when patient safety is subordinate to cost and convenience. But we must be honest, memorials are important, but they are not recompense. They are mourning, not justice. And despite progress, problems remain. Many victims fear they will still die before seeing a penny. Chronic sufferers of hepatitis C, especially those treated with interferon, a brutal drug with life-altering side effects, still await fair recognition. And the scandal of unethical research, often performed without consent on vulnerable patients, remains under-addressed. Sir Brian was right to keep the inquiry open after publishing his report. He knew the temptation to stall. The victims know it too. Justice is denied if justice is delayed, and they've had 4 decades of delay. It seems to be a sort of British disease, to recognise the problem, to hold an inquiry and delay. This is a national disgrace, not an historical footnote. It's happening now. People are dying, waiting, fighting. And they're not fighting for pity, they're fighting for truth, dignity and accountability. The infected blood scandal must be remembered not simply as a failure of the past, but as a test of present-day morality. How a state responds to its own wrongdoing is the clearest test of its character. And the reforms should come faster. The payments should reach those who deserve them. And this shouldn't be repeated.